Great. So it really is an honor and a humbling privilege to represent this organization, the Armenian American Health Professionals Organization. It's been an incredible journey. It all started with a dream over 30 years ago when our founders, a pharmacist, Corinne Nalbandian, whose wife just left, sat top, Navid Kasabian and Dr. John Yoseshin had a very novel idea for the time, and that was to bring all healthcare providers together so we could be the safety net for our communities, and we can work as that invisible hand, giving hope and saving lives for people whom we've never met. And for the last 30 years, that's what we've done. Everybody here who has contributed their time, their effort, their finances can feel really good about being here because you have helped give hope to people whom we will never meet. Really an amazing feat. So now what makes us so strong is our diversity. We discovered diversity before it was something in fashion. Our members collaborate together with like-minded organizations throughout the entire world. We're not looking for credit, we're looking for solutions, we're looking for accomplishments. And our accomplishments can now be measured 30 years later by this list that each of you have on your table, and I encourage you to read it, but we have colleagues who came as mentees who are now mentors. We have people who were students who are now physicians. We have scholarship winners, some of whom are here today. We have continuing medical education credits. We've given over 40,000 hours of continuing medical education free of charge to our brethren in Armenia, in a country where no continuing medical education even existed before we started. And we help facilitate the adoption of requirements for continuing medical education in this country. Now, in America, we don't worry about that. We have to do it. It's legislated. But where we were working, it was a wilderness when it came to continuing medical education. And every one of those credits gave education, which provided better health care to people who otherwise would not have received it. I'd like to give special thanks again to everybody in our community who has really helped us. And we have hopefully reciprocated by giving and sharing the depth and breadth of our knowledge and skills with all of you. We stand ready to help. I look around the audience and I see many people who responded to that quick text, email, phone call. Hey, we have a member of our community who's acutely ill. Can you help? And so many of you have stood up and helped. And I want to thank you from the bottom of my heart. It really is not easy to make those calls, but it's gratifying to know that so many of you respond in such a generous and benevolent way. Today, we begin our next decade of service energized by our exemplary membership, by our successful programs, our dedicated staff, our board members, and our membership. We're grateful to the encouragement from our donors and from our volunteers who are here today. Together, we will address the unknown challenges that uncertainly will confront us as we move forward. We stand ready as a medical resource and as a safety net for our communities. Working together, we again are that invisible hand that will provide hope for a healthier future and help many brethren again whom we will never meet. So again, thank you so much for being here. It really is a pleasure. And congratulations to all of you on celebrating our 30th anniversary. Now, another part of our programming is scholarship, and I want to really thank my parents for helping with this, with scholarships from our family, meant for any student in the healthcare professions graduate level. And we're very lucky tonight to have our third scholarship winner with us today. Unfortunately, he missed the actual presentation, but is here today to accept it. Christopher Markoshian is someone who we have known in this organization since he was a high school student and came to our first mentoring event. And I turned to his parents, why is he here? He's only in high school, but he wants to be a doctor. And not only did he want to be a doctor, he wanted to be an MD, medical doctor, and a PhD, a double doctor. So really impressive. He received his Bachelor's of Arts degree in molecular biology and biochemistry with highest honors, summa cum laude, from Rutgers University, New Brunswick in 2018. He subsequently went to Armenia, to Yerevan, as a Fulbright scholar to teach Armenian as an English, to teach English in Armenia. and came back and now is enrolled in an MD-PhD program at Rutgers School of Medicine. He recently earned his Doctor of Philosophy in Biomedical Sciences, and I will read you what he does, and he can maybe tell us what he does. But target discovery of non-human primates with hereditary colon cancer under the supervision of Dr. Rena Pesquani and Dr. Arab. His research is focused on the vascular ligand receptor mapping and translation, clinical outcomes, and global health capacity building. He's already been published in over 30 publications. That's really quite a feat. Chris, come on up, and let's give Christopher a big round of applause.
I don't have to do a picture.
He's also not shy. He wants to speak. After defending a PhD thesis, he knows how to hold his own.
Thank you, Larry. I just want to say thank you, everyone, for being here. The applause. I really appreciate these events. I think it's important for the health professionals in our community to come together.